Hi, I am Dr. Dharma Kumar K G, consultant surgical oncologist at Manipal Hospital Sarjapur Road, Bangalore. Today I will be discussing about the lumps in any part of the body. So lumps can occur in any part of the body like face, neck, limbs, or in the trunk, and also it can occur in breast. So most of the lumps what we see in day-to-day practice are benign lumps. That means that they are not cancerous. Most of them it could be because of the infection, or it could be because of the benign tumors like lipomas or fibrolipomas or neurofibromas. So usually these lumps, if it is an infection, the lumps are very short living, like 1 week to 10 days. If it is a benign tumors, these lumps will be there for months together or years together. So they don't cause any harm to the human body. So whereas if the lumps are short lived, like 2 to 3 months duration, especially if they are painless, then we have to worry about the lumps. Then we have to get evaluated for the chance of cancer by an oncosurgeon or oncologist. Say most commonly the lump occurs especially in women is the breast. Breast lumps are usually painless, and if the lump is associated with other symptoms like if the lump is hard, if there is a variation in the size of the breast, or if there is any swelling in the armpit, or if there is any skin change, or if the nipple is retracted. So these, if a patient has any of these symptoms, then we have to evaluate it for the breast cancer. Then the patient get be evaluated. And if most of the time, and especially in 20-30 age group of females, these lumps are benign like fibroadenoma. We don't need to worry about those lumps. We don't require any surgical treatment for these lumps. So other most common site of a lump is it's in the neck. So where there is an enlargement of cervical lymph nodes, or there may be a thyroid swelling or parotid swelling. So neck swelling like lymph nodes can be because of the infection. If it is there, enlarged and hard and fixed, and if there is wound in the mouth, then we have to suspect about the cancer. And if there is a thyroid swelling, again there is a possibility of cancer, especially if it is a recent onset in a male, and especially in children's, then we have to evaluate it for a cancer. Then lump can also occur in limbs and trunk. So most of these swellings in the limbs and trunks are benign swellings like lipomas and neurofibromas. We don't need anything for them. They will have multiple swellings. If the lump is deep-seated and hard and it is restricted movement, then we have to evaluate it for a chance of malignancy. So the take-home message is, not all the lumps are cancerous. So most of the lump what we see in day-to-day practice is benign lumps, and it could be infectious or benign tumors. So if there is any high suspicious symptoms or sign as I explained, then we have to get evaluated by an oncologist or oncosurgeon for further diagnosis and treatment. Thank you.